to read a symptom from a face of a patient, how to analyze the symptom into the language where the patient has said, ગુજરાતી ઇંગ્લિશ તામિલ મરાઠી જેમાં બોલ્યા હોય એમાંથી ઇંગ્લિશમાં ટ્રાન્સફર કરીને રૂબ્રિકમાં કન્વર્ટ કરવાનું. આ પણ એક આર્ટ છે. Every moment, as I said, college, we get graduated from college with a blank mind. But as we progress further, as a homeopath, we evolve ourselves. Every successful homeopath sitting here has self-molded themselves. પોતે મહેનત કરીને અહીંયા સુધી પહોંચ્યા છે. એક એમટી હાર્ડ ડિસ્ક સાથે ગ્રેજ્યુએશન સાથે બહાર આવ્યા હતા અને જ્યાં અહીંયા ઊભા છે ત્યાં એમને પોતાની મહેનત છે. જે કંઈ પણ મટીરિયલ એમણે આવ્યું વાંચ્યું એ બધા છે. સો એવરી હોમિયોપેથ ઇઝ અ સેલ્ફ ડેવલપ્ડ હોમિયોપેથ છે. Textbook can only teach us drug pictures, repertoire rubrics, but it's only the clinical experience can teach us how to heal the sick. If I just compare homeopathy in a college and homeopathy in a practice, college is about memory, exam test, how well we memorize remedy picture, organon aphorisms, diagnostic criteria to clear a test. Practice is about perception. Real patient don't present like a textbook chapter. You have to observe subtle behaviors, uncover hidden emotions, spot the PQRS, symptoms in real time. Exams are standardized, healing is individualized. College teaches you the science, that is rule, data about homeopathy. But actual clinical practice is where you master the art, adapting the rules to cure the unique human being. From healing patient to growing your practice, what college never taught us is real clinical wisdom. He hasn't learned in the classroom. He grows slowly over the years in treating patients. At times passes, a doctor gains much deeper, more practical understanding of how homeopathy actually works in real life. Textbook teaches you the science in homeopathy, but your real world practice teaches you the art of being a successful homeopathic practitioner. To build a strong bridge between college lecture and a real world clinical success, I have certain thoughts in my mind. Whatever I present today is my thoughts, is my perception, I am just sharing that. આજે આ રિયલ વર્લ્ડમાં રિયલ વર્લ્ડ ડિસ્ક્લેમર્સ આપવાનું બહુ જરૂરી છે. Number 1, updating a college syllabus. The idea is we modernize what we teach students by integrating case-based problem solving, lifestyle modification analysis, and drug suppression management to handle modern health challenges. Syllabus are fixed for around the year. 15 વર્ષે એકવાર syllabus revamp થાય. But what about the real practice challenges? Now, for example, textbooks often give us a clean case, but in real OPD today, we get cases with patient comes with severe suppression for using prolonged steroids, using antibiotics, undue use of antibiotics, erratic shift management schedules, erratic shifts of the people પહેલા મેલમાં લોકો ઇરેટિક શિફ્ટ હતા, હવે આઈટીમાં ઇરેટિક શિફ્ટ્સ આવે છે. So all type of patients comes and that disturbs the body biology cycle. This requires very meticulous and chronology timeline history taking. And students need to be known of these suppressed cases. I'll just share one case here. This was during the COVID time and the post-COVID era also. Many patients presented with a sudden spike in blood sugar. Young people, very young age. And they were in a sudden stress. And I was okay again. I don't have any family history. હજી તો મારું સ્ટ્રેસ ચાલુ જ નથી થયું, કારણ કે લગન જ નથી થયા. શુગર વધ્યું કેવી? Many were very young. Even I had a patient who was 29 years whose fasting blood sugar was 260 and PPDS was 320. No history of diabetes. Hardly he has started his career because he was in total comfort zone. Father multimillionaire. Laksh picture જેવું કોઈ લક્ષ જ નહોતું હજી એને. So there was no stress in his mind. But this, because he had a very severe COVID infection during second phase. Long, because the lungs were very involved, steroids go up and remedies. So how to handle this? Now COVID was something beyond our syllabus. हमें पढ़े तरह COVID जो क्या है? COVID is an, I consider as an alien virus. ऊपर थी कसम से आवे, caught us napping, and gradually ruled the world for shorter period. Rather we made to leave it for shorter period. But a period havoc કરી નાખ્યો. Situation which is beyond expectations. જે આપણે જિંદગીમાં ના જોઈએ એવી સિચ્યુએશન જોઈ છે. ઘરે બેસીને લોકડાઉન. I mean, lockdown situation when I was very young. I remember 71 war. I remember that war again. એ વખતે આવી લોકડાઉન સિચ્યુએશન અમે નાખવામાં આવી. એના ક્લિનિકલ એન્ડ પ્રેક્ટિકલ અન્ડરસ્ટેન્ડિંગ એમને પાસે ઘણું નોલેજ છે, છોડતા નહીં. So I searched the repertoire and I found a rubric. Ailments from long-term use of steroids. There are two medicines, Ostigam and Tuja. We have a situation of crisis. આપણને શીખવાડ્યું છે એક જ દવા આપવાની. શુગર આટલું છે, પેશન્ટ ઇન ડિસ્ટ્રેસ છે, તમને ખબર છે તમે નહીં કરો તો બીજે જતા રહેશે. સો યુ હેવ ટુ પ્લાન યોર ટ્રીટમેન્ટ in such a way that you get a result and you retain the patient. So during COVID time, very honestly, I had made my own protocol of treating patient. So I used my protocol, a dose of Thuja and Causticum 13 morning and evening, and I used Thallium metallicum. Why Thallium metallicum? એવી તો કોઈ દવા છે જ નહીં કે કોઈ શુગર સ્પાઇક થઈ જાય તો. Thallium metallicum ના બોરિકની અંદર ફર્સ્ટ લાઇનમાં લખેલું છે affection of glands after exhaustive disease. So I just applied that logic here. Diabetes is a pancreatic gland problem. It is gone into distress because of the high steroids. Its activity has been suppressed. So I use Thallium metallicum every afternoon, and this protocol I used in majority of cases where I found spike in sugar is because of the overuse of steroids, and results were encouraging. જે young boy નો મેં ઉલ્લેખ કર્યો છે, his sugar level dropped. And of course, in many of the cases, I given constitutional medicine also. Constitutional medicine is a very vital part in a homeopathy. कोई पण शॉर्टकट તમે વાપરો કોઈ પણ કરો so called CR is required to close the case or to establish a clean pathway. I will share some of the shortcuts also. I am not a saying કે શોર્ટકટ નથી વાપરે એટલા માટે તમે બેઠા પણ હું તો ઊભો જ હતો કારણ કે શોર્ટકટ મેં વાપરેલા છે. The 28-year boys, after taking this treatment protocol for around 3 to 4 months, he himself developed courage and he stopped his anti-diabetic medicines without my knowledge. Because I am very particular. कोई पेशेंट पूछे कि साहब दवा लेવાની તમારે દવા से ચાલુ રાખવાની તો હમણાં ચાલુ રાખવાની દવા ચાલુ રહેશે એની સાથે જે કે તમારા રિપોર્ટ્સની અંદર ચેન્જીસ આવશે તો that doctor will change your prescription. I do not touch any of the allopathic dosage. Let allopathic doctor decides. Nowadays in the consumer law protection you have to be very careful in practice. I'll come on this later part. Which HbA1c became 5.6 and which was again repeatedly 3 was normal. I always mark 3 reports normal આવે પછી તમે તમારા ડોઝને વેરિએટ કરો એલોપેથી. So his 3 HbA1c was normal. So I endorsed his risk of stopping diabetic pills and he was absolutely fine and he has lived his life. So this is how we have to keep updating our student with the latest problems. Like student doesn't learn Chandipura. So latest problems are that latest problems with homeopathic perspective. Chandipura આવે કે ચાંદોડી આવે એમાં symptoms શું છે that is more important for us. I hope Chandipura fever ની અંદર કોઈ બહુમાં ચાંદી નથી પડતી. It was a fever which was there in the village which was named Chandipura first time. એટલે એના પર નામ. So this allopathic nomenclature also sometimes are very mysterious. Inviting practicing homeopaths as a guest teacher. So I am just putting my point कि यदि अन्य लोगों ने को बोला है माय परीक्षा नहीं अब तक by this it brings the experienced practical homeopathy practitioners into the teaching. So what I told now can be easily shared with the students. A full-time practitioner can teach students, this is also one thing, how to manage 20, 30 patients, 50 patients in a 2 hours time. I've seen Bhaskar Bhai seeing 100 patients in 2 hours in vegetable trust. You can see Sunil Bhai teaching 150 patients in 1 day. So this is how they can teach us how to manage this much of patients in a limited time. Practitioners can show how easily and how fast we can see the PQRS in a case, because experience only makes your observation sharp. I remember when I was working with Dr. Vijay at Irla College, Mumbai, and we were just ready with our history. Vijay used to sit, and there was always a 50 patient he will see in half an hour. 5-6 डॉक्टर्स બધા ઊભા હોય તમારી હિસ્ટ્રી લઈને એ આવે પેશન્ટને બોલાવી ફટફટ હિસ્ટ્રી બોલે અને પેશન્ટ સામે જોતા. સો માય ટર્ન કેમ આઈ વોઝ રેડી વિથ માય બેસ્ટ ટેકન હિસ્ટ્રી. હિસ્ટ્રીની સાથે મને ડૉક્ટર પૂછ્યું કે કઈ મેડિસિન આઈ ડોન્ટ નો સર. because I didn't find any PQRS. क्या करते हो तुम? He saw it the patient and said, ये देखो, one sided perspiration है, ये है, उसका ये है, see the emotionality, ये का repertory follows. That time we were using synthetic repertory, 3 volumes में आवती थी. So synthetic repertory का ये खोलो, ऊपर से नीचे देखो, 2 मार्क की दवाई डर ये है, 3 मार्क की ये है, और 1 मार्क की ये दवाई है. And he never used synthetic repertory, only he has just referred that book some period, but he was mastered in Kent repertory. He could tell Kent repertory na kaya page ko upar thi niche fakra ma chauthi line ache. That's how he has mastered repertory. આપણે એટલું ના કરી શકીએ પણ એટલીસ્ટ રેપર્ટરી વાંચતા તો થઈ શકીએ. So that observation, that quickness in finding the PQRS, that is very vital, and that teaches us. And a student ने कौन सीखवाड़ी सके? The practical homeopathics. अच्छा, मैनेजमेंट ये पर ना करो तो एनो पर एक रस्तो मारी पास है. Compulsory OPD for all PTG practicing OPD practice for all college faculties. कंपल्सरी करવું જોઈએ. બધાએ હોસ્પિટલ વાળાને કામ કરો. Don't just heat up your staff room seats. Now why? Why hospital OPD attendance is essential for doctors, teachers? Teaching faculty running a regular OPD, it creates a strong beneficial link to keep academic theory connected to real patient case. It benefits students also. For teachers, it sharpens their theoretical knowledge in applying on the practice. A teacher who treats real patient speaks with authentic authority. एना वर्ड ની અંદર authority देखा. He can teach the real Harry's law. He can teach that this patient has, this symptom has disappeared, now this has happened. So the clear understanding of or philosophy, which is the most boring subject of our homeopathy, into a most interesting subject by showing it on the patient. They will not quote the 100-year-old headings ने हरे मरना केसेस पर अपन नहीं बनाते, रियल पेशेंट्स को बनाते. And how it benefit students? It bridges what they learn in the class, immediately they will see in the practice. So that helps in understanding. A teacher who practices medicine doesn't just give a lecture. Their teaching turns lessons into living medicines. Now if you see how the real patient cures drives the practice growth. Now the real clinic growth isn't built on loud advertisement or fancy slogans or social media advertisements. It doesn't build on that. As I said, by this you get one or few patients, because now as this media reach has gone to the deepest level, there are few in this crores of people, you will get at least one person which will try to kariye આ માણસ પાસે. તો બાજુવાળો બહુ મોંઘો છે, કાં તો અવેલેબલ નથી, કાં તો attitude છે, all sort of things will make the patient to change the doctor. So you will get a new case, but it will not build up your practice. Now again short exercise. Now how we understand a practical homeopathy? Shortcut के साची साथ आनी पर एक क्विज करिए. केबीसी पर શરૂ થાય છે તો આપણે અહીંથી શરૂ કરીએ. I'll just give you a situation with enough 4 different possibilities of situation. You to guess the answer. For example, a patient with chronic psoriasis returns after 15 days and they say, Doctor, my skin is itching is 20% more, but I'm sleeping much better and my digestion has finally cleared up. What is your clinical assessment on this? The remedy is wrong, change it immediately and stop the itching. Or this is a placebo effect. Or this is a positive direction of cure, that is Harry's law, reassure and wait. Or add a local ointment to suppress the itch while the internal medicine is working. Homeopathic ointments are also available. What could be the C? देखिए कंप्यूटर मार्क्स क्या कहता है सी सही जवाब नेक्स्ट सिचुएशन a Google doctor question. This situation I taken from the real experience what patient comes nowadays. A new patient, and nowadays patient comes with a homeopathic medicine study also. A new patient arrives with a printout from Google and say, I read out about your lycopodium what you given last week, and it's the best my gas problem. Why are you asking me so much of questions about my childhood and my preferences of home food and all these, that. What is the best to retain this patient? Tell them Google is completely wrong and they should not read it. Ignore the comment and keep asking. Explain that Google treats the disease name, but I am treating the human being who has the disease. Or just give them lycopodium to keep them happy and change it later. B and C. Correct answer is C. So C, the teacher is always more logical. The OPD time crunch. You have 10 patients waiting in the hall. That's which okay, go ahead. And you have only 1 hour before you must leave for a meeting or a date. A new chronic case walks in that which requires 45 minutes for a full history. How do you will handle this? તમને બોલે તો એ પણ ડાઉટ છે કે બાજુમાં જતો રહેશે સામેના કોમ્પ્લેક્સમાં નવો જ આવ્યો છે. Rush the case in 10 minutes and give a generic remedy. Take the acute symptoms now, give a temporary remedy, schedule a deep dive appointment for the next week. Tell the patient to come back tomorrow without seeing them at all. Stay late, make all 10 waiting patients angry, and more important, make your date angry. B. Let's see, computer master. As I said, homeopaths will always differ in their thinking, because again, homeopathy is also customized in our mind also. Next situation, ethical referral. A patient with high fever for 4 days is not responding to your best selected remedy. They are becoming drowsy and have a stiff neck. What is the key point to learn? Change the potency to 1 amp and wait 12 hours. Tell them to take a cold shower and stay home. Immediately refer to the hospital for possible meningitis ruling out. Don't refer because you might lose the patient. અડધો કલાકમાં આપણું સિંકિંગ ચાલુ થઈ ગયું છે. Today's time, social media viral trap. A social media marketing agency tells you If you post a video saying you can cure stage 4 cancer in a month, you will get a 1 million views and 500 new patients. I guarantee you, sir, આ પેકેજ લઈ લો તમે ફક્ત 40,000 રૂપિયા છે. Why should we refuse this? It is a violation of Drugs and Magic Remedies Act, and it's illegal. It builds a one patient foundation that will destroy your reputation in 6 months. It is ethically dishonest to the science of homeopathy, or all of them. Let's see. सही जवाब. As a patient is leaving the room and has their hand on the door to just open the handle, it turns around and say, "Oh, by the way, doctor, I forgot to mention this symptom." A strange lump in my throat when I get a sad feeling. You already given constitutional medicine after 3 hours of case taking. પછી તમે બહુ મહેનત કરી આખું રૂબ્રિક ચાર્ટ બનાવીને એક દવા ઓલરેડી આપી દીધી છે અને ભાઈ ખાઈને બહાર નીકળી જ રહ્યા છે ને આ સિમ્પટમ બોલે છે. What you will do? Tell them it's too late. You will talk about this one later. Immediately sit back. This late coming symptom is often considered as a PQRS. Give them a generic throat lozenges. Our homeopathic માં પણ આવે છે lozenges. Ignore it as a minor detail. सही जवाब. Main takeaway of this is a good doctor is only 50% of about choosing the right medicine, but the 50% is about knowing how to talk with the patient, handle clinical pressure, and practice ethically. This small exercise has made us a little more practical. What practical homeopath thinks. I'll just share you a few short cases which I've taken. Cases which I'll share I've taken from my clinic and from the trust clinic where the time period is short and you will see more patient. So as I told you, we will come to the PQRS very fast. In trust clinic, આપણા કરતા patient વધારે impatient. સાહેબ જલ્દી કરો, બહાર બહુ બેઠા છે તમારે. A man, 52 years, came with severe pain and swelling of right ankle with inability to walk. Pain was sudden, severe, forcing him to constantly hold his foot with the hand, which prevents the movement. He was given Corina 200, he was given Ledum, but no change in pain. He was given Rustox also. તો જ્યારે પણ આવે ત્યારે આ રીતે જ પંજો પકડીને બેઠવાનો. Even I have CCTV, so જ્યારે બહાર બેઠા હતા મેં જોયું કે કઈ રીતે what is this movement. See, when a patient does not get relief from our practice, આપણે કઈ ને કઈ એવું કર્યા કરી જોવા મળે. So I see my CCTV કે શું કરે છે બહાર બેઠો. And I saw that he did it, foot પકડીને બેસી રહ્યો હતો. So I took that as a symptom. Pain suddenly, support desire, pain, rest, emulates. I gave this medicine and there was a drastic improvement. Bambusa. Bambusa is one of the very strong medicine for desire to be supported at physical level and at mental level. There's another case of 56-year-old male came with a complaint of rat beak eruptions, hives or urticaria જે આપણે કહીએ છીએ, on forearm, bilaterally. Itching was more at the evening, aggravation by eating sour foods. There was a history of chikungunya 5 months back, and after that, that skin eruptions have started. History of worms in childhood. Appetite reduced after chikungunya, craving for sweets, warm food, scanty perspirations. Temperamentally, he mixes very well, very cool nature, very religious minded. So whatever medicine is creeping in your mind, all given. Particular areas atheni, apis આપી દીધેલી, versatile આપેલી, બધી પેલા બધા protocol આવી જાય. But still it does not happen. So sometimes you have to again look back. I worked with Dr. R.K. I had a privilege of working, and it was one of the best hard time also and good time also to be with him. And he always used to tell me, સવાર સેશન પતે એટલે મને કહે કયા પેશન્ટ તમને યાદ કરે છે? બધું સર એકે નહીં, 11 વાગ્યા છે, મારે જવું છે. So he said કે at the end of clinic hours તમારા મગજમાં પેશન્ટ્સ દેખાવા જોઈએ કે આ પેશન્ટ્સને હું આજે નથી મટાડી શકું. So that feeling of to do something for patient makes you to think deeper in that case. Or else our approach will be the same as what approach is at government doctors in government OPD. અઠવાડિયામાં એકવાર પેશન્ટ ડોક્ટર આવે અને બીજા અઠવાડિયે કયો ડોક્ટર હાથમાં આવશે કોઈને ખબર ના હોય. Or if same patients you are going to see in follow-up, you have to think કે આ પેશન્ટમાં હું શું મિસ કર્યું છે. Either I have missed to see the symptom, or I have missed to analyze the symptoms, or patient symptom લેવાનું રહી ગયું છે. So I just understood that chikungunya is what affection of joints. After that, this pain has started. So eruptions alternating with rheumatic complaints, urtica urines, and patient improved drastically. Even Rustox is also one of the other medicine. So these are the Hahnemann advices કે કોઈ પણ કેસની અંદર સૌથી પહેલા causative factor ગોતવા. Cause, as per the Kantian analysis, cause is the first important things. Cause હોય એટલે બીજું બધું પાછળ જતું હોય. But it's our mind. આપણે આપણું લોજિક લગાડી દરેક વસ્તુને કોઝમાં ઘુસાડીને એની દવા આપી દઈએ. That doesn't matter. What Hahnemann cautions us, he cautions that physician against the danger of speculating and creating own theories on the ultimate cause or mechanism of disease. You should not torify the symptom and analyze according to your convenience. This is some of the drawbacks of some school of thoughts, where very vague analysis they will do it, some vague rubric which is very hard to see what symptoms kya આમાં દેખાય છે. But they will convince you, and they will find a remedy. So the pleasure they get it is finding a remedy. They don't get a pleasure in seeing the follow. And આ ઉપર આખો સેમિનાર થઈ જાય. So Hahnemann is very cautious. He says that you just take it what patient presents. Only analyze which is a covered patients. Every case for us is a customized. Every case is like akhrot. Akhrot હાથે તોડ્યા છે. Every akhrot will have a different intensity of pressure you will give it. કોઈ અખરોટ એકદમ સોફ્ટ હોય તમને PQRS તરત મળી જાય. કોઈ અખરોટ એવા હોય અમે નાનપણમાં વોલનટ ક્રેકર્સ નહોતા મળતા, તો બાનાની વચ્ચે ઘૂસેલી અખરોટ તોડતા. હાર્ડ નટ ટુ ક્રેક. સો ઘણા કેસીસ એવા હોય કે તમારે વધારે ડીપ જવું પડે. સો એવરી કેસ ઇઝ લાઈક ધેટ. ઇટ ઇઝ ધ ઇન્ટેન્સિટી ઓફ અ પર્સન હુ ઇઝ હોલ્ડિંગ ધેટ અખરોટ ટુ ડિસાઇડ કેટલું પ્રેશર અથવા તો કેટલું ઇન્ટેન્સિટી આ કેસમાં જરૂર પડશે. એકોર્ડિંગલી યુ ડુ ઇટ. So treating the cases many a times makes you in a very typical situation where you don't get anything. You feel you are blocked, and the case is blocked or your mind is blocked, and then you study and see that what we do that we get a result in this, or I obstacle introduce. આ કેસને આ બતાવ્યું એટલે મજા આવી. So ये करता करता we have I found some of the tips in homeopathy. So I'll just share its few. I call it homeopathic quick bites. These are the few tips which I used in my practice, which may help you. होम्योपैथी में एक वस्तु सारी बहुत है कि टिप्स तरत काम करे. होम्योपैथी में खराब बहुत है कि टिप्स क्यारे काम ना करे. It is only the right key which will open the right lock. Sleeplessness with anemia, with restlessness. I had a case of insomnia. અને જાત જાતની દવા આપી આપીને થાકી ગઈ. While studying some references, I found this combination. I think so it was in Nash. I found it. It was mentioned Calibrom, a sleeplessness with anemia with restlessness. I gave Calibrom and it helped me to clear the obstacles and I could progress further. It improves the sleeplessness to a great extent. There was a case of boils, recurrent boils, one after another. एक मटे बीजू था, एक मटे बीजू था. And patients के मैंने boil ने वो थोड़ी और if I take a hot shower, मैंने बहुत सारू लगा. जो स्टीमिंग बर्निंग के वो थोड़ी मैंने बहुत सारू लगा. तो तरह तरह मेडिसिन तो आपकी सरस फर्स्ट ईयर की मेडिसिन मुकद में आ गई है. आर्ट्स निकाल आपकी temporary relief, patient again back. Again this is a good part of homeopathy. जो patient તમારી convince થઈ ગયું તો પાછો આવશે. આશા સાથે આવશે. But next follow up is again a challenge. Next follow up માં તમારે result આપવું પડશે. ये तो गयो. So I found that no, this is something when the symptoms are recurring, my medicine is not right. So I thought, which is the burning medicine of the materia medica? Anthracinum is the most burning, very close to arsenica. I gave it and it cleared the recurrences. Another case I had recently of crack at mucosa, corner of mouth. પેશન્ટને ઘણું સારું થયું, બધામાં સારું થયું, આ બધામાં સારું છે, પણ આ સાહેબ આ મટતું નથી. અને રોજ ખાવા માટે અંદર મોઢું ખોલું છું અને ગઈકાલે જ પાણીપુરી ખાલી એમાં વધી ગઈ છે. સો નો મેડિસિન વોઝ વર્કિંગ. મક્સોલ ને એની સીઆર પણ આપી કશું ના કામ કર્યું. I did Condorongo is the one of the best medicines that regards at mucocutaneous and it helps to improve. Another I found very interesting. પેશન્ટ આવીને કહે છે સાહેબ 2 દિવસ પહેલા ખાધેલું ને કોથમીર નાખી જાય છે, અથવા સવારે જે ખાધેલું હોય સાંજે પાર્ટિકલ્સ દેખાય છે. Whether you feel disgusting or homeopathy is the most disgusting person dissecting the stool every practice. કેવું સ્ટૂલ થાય છે, કેવું થાય, અંદર શું હોય છે, પેશન્ટને ડિસ્કસ થાય પણ તમારી થાકવાની નહીં ચંચળતા. I asked once patient કે સ્ટૂલ કેવું થાય, કેવું થાય શું ખબર પડે. I said okay, ટૂથપેસ્ટ જેવું થાય છે, ચોળાફળી ચટણી જેવું થાય છે. Then patient understood એટલે કે કાલથી ચોળાફળી નહીં ખાવાની. Now head injury medicines. Different medicines create different type of symptoms. Now some of the things I have taken from my notebook મારા હાથમાં આવી 1990 onwards ની જ્યારે પ્રેક્ટિસમાં પુષ્કળ ટાઈમ હતો પણ પેશન્ટ નહોતા અને એ વખતે fortunately हमारे पास में phone न था. So we only had a time of books. So we used to read the books, take out our points જે આપણને ઇન્ટરેસ્ટિંગ લાગે અને એ નોટબુકમાં લખીને મેન્ટેન કરતા હતા. પછી એ નોટબુક ફોન આવે એટલે નોટબુક ખોવાઈ ગઈ. અરે હતી ખાનામાં જ પણ હાથમાં નથી. Now I took out that book અને એમાંથી આ બધા પોઈન્ટ્સ મેં તમારી જોડે શેર કરું છું, which I had noted when I started my practice. Lateral surf is very helpful when mental symptoms develop after head injury. Arnica is very helpful if it is a physical symptoms after head injury. Emotional symptoms આવે તો either ignitia, aconite or phosphorus. And cicuta is very important when there is a convulsions or a childish behavior. This I have used in my practice. Injury to joints, first remedy we give it arnica, but if it fails, give bryonia. As is the injury to ligaments, we give arnica, we give bryonia, we give rustox, but if fails, think of fatalica. And this has helped me. Picric acid I consider as a homeopathic neurobion fault. Diabetic neuropathy, debility, exhaustion with disinclination to do any exertion. Again, it is very good remedy for boils in auditory canal. કાનની અંદર જે ઘૂમરા થાય. Now, depression with liver complaints. Cardas is very good remedy. Now, how we say patient in depression કેવી રીતે? So I had a patient, he was an onco surgeon, and his wife was my patient. Onco surgeon was totally against homeopathy. Wife was pro homeopathy. So she used to come and take the treatment for herself and her children. One day, this lady oncologist wife called me and said કે તમારા હસબન્ડ સાથે વાત કરો, એમને જોન્ડિસ થયો છે અને એ સુનમુન થઈ ગયા છે અને એમની રૂમમાં પુરાઈ ગઈ છે. એમને મેં કહ્યું, એટલે એ તો ના માન્યા, પણ એમને એક પીડિયાટ્રિક ફ્રેન્ડ આવ્યો, એણે કીધું કે ભાઈ આમાં આપણી એને હિપેટાઇટિસ ઈ થયો કે આમાં આપણી કોઈ મેડિસિન નથી, ભાઈ તું કંઈક હોમિયોપેથી ટ્રાય કર. So my husband has called me in the morning and કે તારા પહેલા હોમિયોપેથને ફોન કર અને દવા મોકલાવવાનું કે. So I said મારે સિમ્પટમ લેવા પડે. So આવવાનો તો સવાલ જ નહોતો. His bilirubin was 32, very high infection. So I took telephonic symptoms. He said બસ હું પ્રેક્ટિસ કરતો નથી સાહેબ, હું બેસી રહ્યો છું, રાહ જોઉં છું ક્યારે કોલ આવે અને તમને બીજું શું ભાવે, ખાવાનું શું છે સાહેબ, સંતરા ખાઉં છું બેઠો બેઠો. So taking these few symptoms, I gave him Cardas. Cardas is having a depression with clinical this liver complaints. Cardas is having symptom, તમે બોરીમાં માનશો, craving for sour fruits. I gave Cardas. I sent medicine for 15 days. As usual, as expected, disappeared. No news from the doctor. And આપણે થઈ ગયું કે એલોપેથ છે, આપણી મેડિસિન લીધી નહીં. But at the third week, I received a call from that surgeon. કે you are the first person I am calling this morning because આજે હું મારી હોસ્પિટલમાં પહેલી સર્જરી કરવા જઉં છું. And my bilirubin today is 3. So this, he became pro-homeopathy. Nearly next week, he called me કે ડૉક્ટર હું આવું છું મારી વાઇફને લઈને, એને સિવિયર એક્યુટ વર્ટિગો થયો છે અને હું તમે એની દવા કરો, તમે ડિસાઇડ કરો કે ન્યુરો ફિઝિશિયન પાસે જવું કે નહીં. This is where you get a real pleasure in treating anti-homeopathic patients. The best patient I'd like to treat is allopathic doctors. was 30 because 200 I didn't have it, and because it was too acute, it was a frequent repetitions. Now another remedy very interesting, Plantago, अपन बधाने શીખવાડી છે કે દાંત માટે આપવાની દવા. But I read it and I practiced it also, and it was wonderfully result. કે Plantago તો આપણે ખબર છે, હવે અમારી હોસ્પિટલમાં VFC in Saudi we had a very good hospital, lots of deliveries, lots of OPD patients. Fortunately, we had our medical officer like Sunil Bhai, who used to see number of patients. PT Patel sir was having his skin OPDs. We have a excellent clinical exposure we had. हमारी वक्त में इतनी deliveries थी कि हमारा gynecologist अठाड़ा night shifts रखे students में. We have to stay in a hospital night out मारे जाओ. We used to go in a hospital for a night out, and we used to see the deliveries, conduct the deliveries also. We had opportunity to do that. These all were very friendly. Chalo karo. So we have done that. I'm sorry, Tamil logo atla nathi maltu. Thanks to the homeopathic policies which is there top from. Now Plantago, Dr. Clark mentions that like calendula, Plantago Q can be used for dressing lacerated and incised wound, especially if there is a painful swelling and erysipetalous inflammation. What is meaning that? There is a bacterial growth on the inflammation side. Cellulitis here. Sorry, and then I had a patient of cellulitis, they recently watching. So in my practice, I always have a habit of doing experiments with the patient, with the things which we read it. Homeopathic वस्तु सारी એટલી છે કે it is not fatal. It's not going to create any fatal reaction. અને ધારો કે કરી તો પેશન્ટ ગોતી નથી શકતો. બિંદાસ લોજિકલી જે તમને વાંચે અને પેશન્ટમાં દેખાય તો આપો કરો, રિઝલ્ટ જોશો તો એ તમને યાદ રહી જશે. અને સેલ્યુલાઇટિસના પેશન્ટને આઈ યુઝ પ્લાન્ટેગો. કોટનની અંદર પ્લાન્ટેગો ટિંચરને પાણીમાં ડાયલ્યુટ કરી, એ જે મેડિકેટેડ પાણી થાય એને કોટનમાં ડીપ કરી, I asked him to put that cotton on that patch or the skin where the cellulitis was there. And patient responded very well, very rapidly. Even the treating allopatist was very happy that I have to jaldi care resolve it. So Plantago also one of the things you can think about in dressing other than calendula. Now boils. Now this is I use from this literature in my practice, not all. But again, this is from the literature which I read it and I put it in my book. Boils na location ઉપરથી પણ તમે આ દવા આપી શકો. ઓકે, આ બધું ત્યારે કામ કરે જ્યારે ઓલરેડી સિલેક્ટેડ મેડિસિન કામ ના કરે. Tip of the nose, aconite or anthracynum. Boil over the left eye, netramure, in the axilla, lycopodium and phosphorus. Boil near anus, petroleum. Boil at the perianal region is peonia, that is fistula in ano. I use this very often and it helps. Boil in thighs, hyosamus and ignitia. Boil over calves, silicia, and boils on the foot, retania. This combination I have used very often in my practice. Whenever there is a weakness of joints, especially the ankle માં બહુ frequently sprain થતું હોય અને પેશન્ટ કહે કે હજી આ 5 વર્ષ પહેલા મને સ્પ્રેન થયું પણ હજી મને શિયાળામાં આમાં બહુ પેઇન થાય છે, then you can think of giving strontium cup 200 followed by calcarea ka 30. This combination I used in my practice. This is very interesting rubric I used recently where nothing was working. This one problem which very nagging but equally important like a population burning nowadays is hair fall. Hair fall is a burning Indian government should declare as a national problem. Hair fall. You can do anything and it nothing helps. And if you have capacity to fool patients, you can definitely mint money on this. કંઈ પણ આપો કામ નથી કરવાનું તો તમને તમારી ગાડી ચેન્જ થશે. This hair fall. And I use this symptom which I found it in Fatak. Hair fall from changing hair color. I gave Kali iron and it helped in treating. Hair color बंद करवाना if you have guts to tell the girls. You cannot. Now this topic I just thought of because it's very important nowadays in everybody now, not only youngsters. જ્યારથી ભાઈ AI આવ્યા છે versus we have stopped bothering our brain. So I just specifically has taken up this topic. I may not go deeper into it because it's very interesting. It requires more pondering. Maybe we'll talk sometime later on deeper on this. But just I give you a glimpse on this. If not, I think